Hey there, welcome to Gals Get Real, where real women, real stories, and real talk come together. I'm Meghan.
I'm Kristin. Between us, we have 9 adult children with 6 daughters. Let's open up the conversations we never had with our moms and flip the script with the kind of connections we want with each other and our daughters.
We're here to laugh, cry, and dive into all the things, from everyday shifts to the curveballs and life pivots, and the messy, magical moments that make us who we are.
Meghan, I'm so excited. We have such a special guest today.
I know. I'm thrilled. Can't wait for this conversation.
We have Dr. Shieva Ghofrany, who has been an OB-GYN in private practice since 1999 in Connecticut. She has had her own personal journey through pregnancy loss, HPV, weight, endometriosis, and then ovarian cancer at age 46. Shieva uses social media to help further engage and educate women on their OB-GYN health and recently started a private telehealth practice as a midlife strategist. Fantastic.
Impressive. Definitely impressive.
Shieva, in your work with women, you cover so many topics. What are some of the most important, do you think?
Hi, ladies. Oh my gosh. You know, whenever people ask me that, I'm like, let me count the ways. There are literally so many. I mean, top line, the most important topic, I think, is actually managing our mindset with regard to all of the clinical entities that we never get to learn in our OB-GYN health, namely things like, what is a normal period? How do we deal with sex and sexuality as a young woman going into our teens, 20s, 30s, 40s? How do we deal with pregnancy avoidance and then pregnancy loss and then traversing pregnancy? Then how do we deal with perimenopause and menopause? I mean, those are just some of them, right? Not even counting things like sexually transmitted infections, relationships. So there's so many. I mean, that's why it's really, right?
Oh my God.
And they
so
relate
many.
to our health and our mindset, and they're all intertwined. And because of the lack of education, that to me is the biggest part that affects our ability to kind of traverse it well and wrangle our mindset and stay healthy, emotionally and physically. So things like this, I mean, podcasts like this to me are so valuable because then we can use this period of time to just help women strategize and understand so many parts of their health.
I love the mindset piece because you're right. That's where education comes in and is so important. So here we are. I love in our conversations with you, you've talked about, we all talk about menopause. It is a very big topic, but you mentioned the menopause.
And we're right at that age.
Yes,
we are. And you mentioned the idea of a menopause moment. Can you speak to that?
Well, yeah. I mean, you have probably seen in social media, everyone keeps saying menopause is having a moment. And on one hand, listen, I'm so glad because I've been a doctor for 26 years now, and I was present as a chief resident when that WHI, the very famous study in 2002 came out that really, unfortunately, changed dramatically the landscape of women and hormones. So I've always thought menopause is always having a moment, meaning as long as there are women who are entering midlife, menopause is here. The problem is we really stopped talking about it as a medical community, not individually. I mean, I always talked about it with my patients, but there was not a lot of data. There was not a lot of research. There certainly was not a lot of media attention towards it, right? Women were meant to feel irrelevant after a certain age. All of a sudden.
Not to interrupt, but did you get a lot of training as a doctor when it came to menopause? Because I've heard not so much, right?
Yeah, not so much. I mean, so we didn't. I did in particular because I practiced prior to WHI, which was in 2002. So I was a resident from 99 to 2003. I presented the data like as a chief resident to our grand round. So I remember practicing when we prescribed hormones and then the day we stopped prescribing them. I was lucky that our residency director was a fertility specialist who really cared about hormones. So we learned more than most. And I had a great private practice where I was able to talk about it with our patients. But for 15 plus years, the dictum was, if you're really suffering and you've tried everything else, we could consider hormones, but there's a risk of heart attack, stroke, and blood clots. That's what I would tell everyone. And now we know so much more, which doesn't mean it's without risk. But so all of a sudden, in the last 5 to 7 years, because of some really particularly interesting media attention, again, menopause is having a moment, people keep saying. And I think many of us are frustrated by that term because while we're happy it's finally in the spotlight, having a moment implies it's fleeting, right? It implies there's like 15 minutes of fame and by next month it'll be gone. And that shouldn't be true. I mean, again, as women, as long as women are on this earth, which we should be here longer than anyone, And as long as we are lucky enough to get into that midlife period of our early 50s, we should be talking about menopause. It should not be a fleeting moment. It should be something that we continue to just talk about more and more and research more and more.
Do you feel, Shieva, that there are doctors that agree with you on that, or are there some that are still trying to play catch up?
Okay, so both and. Yes, I think there's millions of doctors who agree, and frankly, millions that know far more than I do about it. They've been in the space longer than me.
Sure.
They've been in the space deeper than me. I still deliver babies, so I'm not only dealing with midlife women. There are unfortunately still doctors who I think are incredibly talented and educated and driving some of the data, but for some reason still feel very reticent to kind of allow women to adopt this notion that they don't have to continue to suffer, that they actually can use hormone replacement. It is not a panacea. It is not without risk, but the risk was probably overstated. And we have a really good body of evidence now that for most women, it actually will be safe. But we have to use caveats, and we have to make sure that we're being judicious in how broad we're kind of encouraging women to think it's going to fix everything. It's not going to fix everything, but we're meant to have our hormones until 51-ish. And then the honest answer is we're meant to die after that. But now we've gamed nature. We live into our 80s and 90s. So it's appropriate to consider using hormones. It doesn't mean every woman needs them necessarily, but it doesn't mean that only right now the data shows something like 4 to 8% of women in America are on hormone replacement. And so even with this like moment and movement, only 4 to 8%. That's the recent data.
Surprising to me.
It is surprising because, well, first of all, is that data super up to date? We don't know. Obviously, data in America when it comes to things like this is not great because our public health system is not widespread. But you would think, and I would think, God, so many more women are in it and talking about it. Everybody knows about vaginal estrogen. Everybody knows that hormone replacement doesn't necessarily cause breast cancer because in our sphere, and if I looked at your feed and my feed, it's that narrative. But that's not the case, really. People are not necessarily getting the news, and it's too bad. So hopefully we'll be able to keep spreading the news. Again, not that hormone replacement is what every single person needs, but that every woman deserves to understand what is happening to their body and to their hormones and to decide for herself whether or not she wants those symptoms. It doesn't have to be if they're really bothersome. It has to be like, I just don't want to have a hot flash and I should be able to help fix it, right?
Right. It's like information. They need the information, and then it's sort of their choice in terms of what they do with that information. Wow. I'm really surprised only 4 to 8%.
I am too. And I just wonder too, and we can touch on this later, what we can do for the next generation that's not 51 and yet facing this. What can they do to prepare themselves, educate ahead of time, or even just prevent? I don't know if there is preventative, but whatever they can do to keep their fitness and health up.
Yeah. Well, we know. I mean, this is the hard part, right? Like we all have daughters. And if we try to tell our daughters, here's what you need to learn preemptively about what's going to happen potentially in your late 30s or early 40s, they're like checked out. I mean, they barely want to know what's happening in the next year or two. So
well said.
I do wish as humans,
so true.
Right? Like I wish as humans, we recognized how valuable it is to like learn things preemptively and not just preemptively for like next year, but for the next decade. But I don't know if that'll ever happen. But I do think that the more and more young people hear people like us, who we still think we're young and vital, and we are. So if they hear people like us who don't feel old, we don't feel over the hill, we don't feel irrelevant, we're talking openly about terms like about sex, about sexuality, about masturbation, about vagina, vulva, like we talked about. It's Say Vagina Month, right? If we're talking about all these things, about our period, about menopause, things that most of us didn't get to hear our mothers talking about. At least that will drip the information so that they will have heard of it and not have to be so scared about all the things that they're going to traverse. None of us really heard about it, right? We grew up not knowing.
Absolutely
I mean, that is one of the reasons
it was never a conversation for me with my mom.
Right. And that's why we're sitting here. And is it really Save Your Vagina Month?
Well, it's not save. That is a good one too, Kristin. It's say vagina, as in, and I don't know who came up with this, but I just saw it.
I got you. So
Right?
this
Say
is a good
vagina.
segue.
Yes.
But maybe that can be the next big thing, right? Save Vagina Month.
Save vagina. Well, I always joke, #save the vagina, but in the context of birthing. But it segues into save the vagina with regard to perimenopause and menopause.
Perfect.
Yeah.
That's exactly
Perfect, which
what we
leads
wanna
to
talk
my
about.
question. Do you agree that women need to talk more about their sexual health? And is it accurate? I've heard a term recently that says use it or lose it. And Are you sort of in agreement with that term? Can you explain to us a little bit what that means?
Yes.
I'm thinking maybe like a muscle. You don't lift weights, and so your muscles sort of disappear, but I'm not sure.
Yeah. Well, first, let's address the first question. Do I think women need to talk more about insert blank anything? Meaning, I think women need to talk about more about everything. We should talk more about, again, our periods, sexually transmitted infections, sex, masturbation, marriage, how challenging marriage is. Do we want to be a mother? Is being a mother wonderful? Like all the things. We should talk about all of it. We don't talk about it enough. All the things. Oh, I love that in unison. We should talk about all the things because, like I always say, if we all talk about all the things, then we find that we all have overlapping Venn diagrams where we all are like, oh my gosh, I feel that way too, right? And then we don't feel alone and we don't feel like we have to like post perfect pictures about our life because we know we're not fooling anyone. So yes, we should talk about it more.
Yes, agreed.
The term use it or lose it kind of makes a lot of us cringe, meaning it's not exactly untrue. Just like you said, if you don't use a muscle, you will lose that muscle mass, will atrophy, right? It will shrink and it won't work as well. When it comes to your vagina, which is the muscular tube, and your vulva, which is the external skin, the nerves, all of that stuff, if you don't exercise those as a muscle and with regard to blood supply into the vagina, the vulva, the nerve endings, then yes, there is an aspect of it's not going to necessarily work as well, right? Meaning, first, mechanically, the opening into the vagina can get taut and smaller, not only because of time and lack of estrogen over time, but also just mechanically. If something doesn't get stretched out, it's going to be a little bit more closed. So it's not that that term is wrong. Technically, it's right? Like if you don't have sex, and it doesn't have to be with someone else. If you don't have sex on your own by either masturbating, if you don't necessarily drive blood supply into that area for the nerves and for the blood vessels, if you don't stretch out the opening to the vagina, if something wants to go in there, then you will potentially have trouble when you're ready to use it. All that said, many of us don't like the term because doesn't it sound so patriarchal, like use it or lose it, honey, pat on the back, right? And so I think that's why those of us who bristle at the term bristle at it because of where it probably came from. It probably came from a group of men who were like, if we don't have sex, it's just going to dry up and shrivel up. Whereas it's not like those same people were not saying use it or lose it, like make sure you masturbate. And so I think we would have warmed up to that idea a little bit more. So that's why,
fantastic news.
That's why it's controversial. Yeah. So yes, use it, but use it on your own in any way you want to use it so that you can continue to have it. Maybe you don't need it right now, but maybe you're going to need it later when you turn 80 or 90. We don't know when we're going to need it. So continue to use it so you have it. Yeah.
Exactly. That's great advice. And would you suggest the younger, the 20, 30 somethings should be doing that too? Or is it more of a later in life kind of menopause and the other issues that appear at that stage?
I mean, the truth is, I think, well, first of all, there's so many layers to the question, right? I think the younger generation in general tends to have more sex than the older generation. Although you guys probably know the data that the young generation right now are actually having less sex, which would sound great if they were choosing to have less sex for the right reasons, meaning they didn't find the right partner, they don't feel honored and respected. But it seems as though there is less sexual relations between people because social media and media in general and our phones are causing a detachment, which is sad, right?
That's so sad.
So that's sad. Do I think, again, unrelated to use it or lose it, do I think we should talk more explicitly to boys and girls about their bodies, honoring their bodies, learning about their bodies, about masturbation? Because like I think you and I talked, the three of us have talked about, think about it with young boys. We're like, son, you've got a penis and you might notice an erection and it's okay, just keep it in private. But with girls, we don't say that. So most girls don't know that honoring their body, learning about themselves, learning how to pleasure themselves is actually so important, not only because it feels good and it's good for our brain, but because then they know how to assert themselves when they're in a relationship in the future with a man or a woman. But so many young girls don't learn that. So they enter into a relationship, and especially if they're with a man, we know the data, right? Most men won't necessarily know how to pleasure a woman. And if a woman doesn't know herself, then that leads to the recipe for the orgasm gap and all of these things that we really understand now.
Boy, young women, listen up.
Yeah. Yeah.
Really good to know.
Yeah.
Wow. No, and I completely agree. It's definitely a double standard when it comes to those types of conversations or what's acceptable versus what's not acceptable, right?
Right. And I think part of it is anatomic, right? Meaning the boy like wakes up in the morning at 2 or 3 years old with a little erection. So you feel like you have to address it. But as women, we have no external obvious sign of it. So I think most families aren't even necessarily being so paternalistic. They just don't think of it. And that's where in the medical community, we have to do better at teaching young parents about what to talk about. But the honest answer is we don't learn about it ourselves. There's no point during residency where we learned or I learned how to instruct parents as to how to talk to their daughters, for example. We don't learn that. So a lot of this is like my pattern recognition of 26 years where I've realized, gosh, this is what's happening to young girls. And we should be able to do better as doctors. And by the way, I would say as parents, like parents should start to be savvy to what some of these things are that they can do to really help girls and boys progress and learn.
Shieva, I love that. And I just have a question for you. At any age in a relationship, do we keep that same desire? If we do make the time and we do have the connection, how does that work?
Well, okay. So a lot of times when my patients, like yesterday, I was on a telehealth call with a patient who said exactly what so many women say. And I'm so glad when they say it so that I can reiterate back, you are so normal. This is so common. And she said, I have a really low libido. And she was, kind of a classic, like 40-something-year-old woman who has a otherwise happy marriage and children and a life and a career. And she said, I have a low libido. And what I correct people with is, to me, the vernacular is really important. Libido is very complicated for women. Like it's so multifactorial, right? For men, it's very different. It's often just erectile dysfunction, which is oversimplifying it. But for them, it's a little bit more cut and dry. For women, it's like how we feel about ourselves, how we feel about our partner. We have the weight of the world in our brain. We have hormones. We have physical. There's so much. So for a lot of us, when we say, I don't have a libido, what we really mean is I don't have the same spontaneous desire that I had when I was young. Like in our 20s, not only because we're young, but more importantly, because we're in often a new relationship. And most of those relationships might not last more than 3 to 5 years, because it seems to be that 3 to 5 year stretch where we love our partner. They're wonderful. And this is true for women, whether we're with a man or a woman, but we don't have the same spontaneous desire, it's called. We often will have what's called receptive desire or responsive desire. Like we started to have sex and I was like, well, this is enjoyable, right? Good enough. I always joke that I think I've told you guys, it's like exercise. Like, I don't want to do it. I don't want to do it. Once I'm in it, I'm like, oh, this is great. I actually really like it. I'm going to do this tomorrow. So that's responsive desire as opposed to what we kind of want. We want spontaneous desire where we just walk around thinking about it like we did when we were younger, which is why we equate it to be young, but it's really actually like we did when we were in a new relationship, which is why.
So it does happen. Sorry, not to interrupt, but it does happen to women in their 20s, their 30s, their 40s. This isn't just sort of
divorcees in their 50s, for example.
Yeah, I was just, someone might be able to tell us. I have patients who are in their 70s and 80s who have robust, exciting sex lives, spontaneous desire, because actually they're in newer relationships. Now, that doesn't mean we all need to couple up with someone new every 3 to 5 years, but it means that the people who probably continue to either have that spontaneous desire, they are doing things to stimulate it without realizing they're even doing it. Just like the people who, there's a difference, I think, between those who dutifully do exercise because it's the right thing versus those who are like, I actually love exercising. And there's probably a bit of mindset, right? Like I love exercising because this is not me, by the way. I do not love exercising. I'm in the first camp. But if I did, I would visualize, I would make sure that like, I want to be that person who feels strong. I want to be that person who's fit. I like how I look. I like how I feel. I like what it does for my brain. Then I would find all different activities that light me up. So when it comes to the sexual realm, many people that I've noticed who have really great sex lives with their long-term partners are doing that. They're strategizing in their mind. They're like, I love it. I'm going to visualize it. I'm going to visualize my partner, or I'm going to visualize other people, which is okay when you talk to sex therapists. They masturbate, they read erotica, they try different things to kind of keep it exciting so they have spontaneous desire. So that to me would be like, those are goals, right? Then there's the second group who I think have really good sex lives because they recognize that it's valuable and important. They're kind of dutifully making sure they're doing it regularly because they and their partners benefit from it. That's also great. And that might be the best many of us can achieve. And then there's what many of us, in fact, I'd say most women that I meet in long-term relationships, even happy ones, are in the like, I guess I will because I kind of feel like I should, but I don't really care if I do. And they mistakenly think it's because they're older or midlife or something, when in reality, it's just the way a female brain seems to work. from a neurochemistry perspective, which is very strange. I really don't get why evolution did this to us and coupled us up with men who have tons of spontaneous desire with testosterone, but I'm sure there is some evolutionary reason. Maybe we were supposed to have new partners every 5 years. I don't know. Or we were going to die. So it didn't matter.
It's an interesting concept, but thank you for the science behind that. I always find that helpful. So you don't think you're alone.
Right. You're not alone. You are not alone. In fact,
spiraling down your own tunnel.
Don't we all know if all those women come to us and say, like our friend groups, if they come to us saying like, oh my God, I love it 3 times a week with my same partner of 20 years, like we joke, unicorns or liars, right? There are some unicorns, but they're probably strategizing. If a lot of people are saying that to you, then you're either in a very unique friend group or you have a lot of people who are telling you what they think everyone else is doing.
Okay, so another question is, I know that you speak at a lot of conventions. What are some of the topics that keep reoccurring that you think are at the top of everyone's list?
Well, when it comes to medical, when I'm in medical spaces, we are constantly talking about perimenopause and menopause, in particular, the controversy of hormones, and in particular, the lack of knowledge about the other P word I call about perimenopause, right? Like, I'm guessing that you are like many women where you're like, I never even heard of perimenopause until like 3 years ago, for example, right? Like most people just didn't hear that.
100%.
Yeah. And that's so common. So in the times I speak medically, meaning either with other colleagues in a medical actual conference or when I'm speaking to regular women about medical issues, it's perimenopause and menopause for sure. But the truth is that common themes that come up are just like what we've talked about. The most common theme, I would say I hear myself personally back from the audience is, oh my gosh, you're so open. I didn't realize that everyone felt this way. Thank you for highlighting it. And I always am like, oh my God, really? Like I thought everyone felt this way because I'm with women all day who are telling me this stuff. And I'm not so silly. I know that they're saying to me, oh, thank you for telling me that. And I didn't realize that even when we're in these private spaces, but I'm consistently shocked. I guess I feel like after 26 years of doing this, like, how are we all so private about it? Like, why are we so private about it? The whole point of social media is to be able to amplify the truth and feel more aligned with each other as opposed to like dividing each other by acting like we have some better life. Nobody's got a perfect life. Nobody, right? We know that, but people still try to purport it. So that's still surprising to me.
Shieva, I second that. You are so real and open. It's really inspiring. And I mean that.
Thank
I
you.
can only imagine it resonates with the younger women.
I hope. Thank you.
No, it 100% does. And I think that to start the open, honest conversations, even when it's uncomfortable, maybe more so with something like this than other topics, I do think it just puts everyone at ease and makes them realize, okay, like this person's experiencing it, that person's experiencing it. So you just don't feel alone, which I think in this world today, a lot of people sort of feel alone in many different areas. And
100%. And it's good to share the information and resources, but it's the stories and the testimonies that really hit home.
Yeah. Well, the irony is that people have never felt so alone despite us all being so connected on the internet. And I do think, I mean, I know you've all experienced this. We all know those people in our world who kind of post like the most perfect pictures of their vacations, of their partners, of their children. Everything's amazing, amazing, amazing. I know enough to know that those things aren't true because I see these women, right? And I know, and I'm actually sad when I see them posting it because I know they're trying to put forth a persona that they don't even believe they're living. No one else believes it. And yet all the other women are like, I know she's not actually that perfect, but now I still feel bad seeing her. So what can I do? Okay, well, I can try to one up her. And so I'm going to post my own great life is good post. And so it ends up being woman after woman kind of subtly trying to impress each other, knowing that they themselves don't have a perfect life, and yet they still think the other person does. And so it just creates this spiral. And again, if I had one piece of advice to every single person, but every single woman, it's like, can you just believe the truth, which is none of us have a perfect life. We all have great things and we all have shitty things. And maybe at different times in our lives, it's more great or more shitty, or maybe your life is a little bit better than mine at certain times and vice versa. But like, there's literally no perfection. So could we stop lying about believing that there is or trying to purport there is? Because it's so damaging in health, in wellness, in marriage, in everything. It's really bad, right?
I mean, hashtag life is good.
Right.
Oh, by the way, a shout out to my sister who runs a store. But, you know, the struggle is real.
Yeah.
And we need to use our ability to connect to share that.
Mm-hmm. Yeah.
Right. Because it just opens conversations. And at the end of the day, to your point, perfection it's unattainable, right? So no matter how good or bad the situation is, I always feel good after I meet with a couple girlfriends and we kind of just are brutally honest with each other
Yeah.
about whatever it is. And you sort of leave feeling uplifted
Right.
because, you just think to yourself, that was a really awesome sharing session versus the white picket fence, which you leave feeling not as good about because everyone's got struggles.
Right. Everybody does. And that's the thing. I mean, we don't even know what perfect is because like my version of perfect is so different than your version of perfect.
So, speaking of social media and seeing you here today, I have to be honest that very few women can wear their hair the way you wear it and still look fabulously gorgeous. So, that is impressive. I also think the honesty, the openness, just the vibe in general sort of makes you literally one of probably, if not the coolest OB-GYN that I have ever met in my life. So I guess my question to you is,
And she's worked with OB-GYNs in London. So,
Oh
and
my
other-
gosh. That is.
well, 5 kids, you do
Yeah.
see a few
Yeah, yeah, yeah.
OB-GYNs.
Yep.
But and now that we're discussing your hair, how does that sort of tie into your open, honest approach to everything? Is there a connection?
Well, I mean, yes, in a way. I actually really mean it when I say I think everything I do and say and kind of like wear and present myself as, like physically, as far as like my jewelry and all these things, follows the same, the necklaces, thank you, follows the same theme, which is I just said this to my kids the other day. How do we reach that balance between I want to assert myself and be the person that I want to be, like I want to express myself the way I want, and I also kind of still need to live in society where I live within certain rules, right? Like I don't want to lose myself and care so much about what people think, but also I don't want to be so individualistic that I'm like a complete outlier. And how do we do that balance? And so to me, my hair has always, like, I've always changed my hair since I was young. I mean, we're all girls from the 70s and 80s. Like I permed my hair a million times. I would, do all kinds of things. I had a tail in the 80s. But when I lost my hair 9 years ago, during chemo, I really thought, just like every other person going through hair loss, that I was going to get a wig. And I got a wig. And I remember thinking, oh, the minute I have to lose my hair, I will shave it off and I will gladly wear like a Kardashian mermaid wig. It is going to be fabulous. It's going to be like the big thick hair I've never had. And I put on that wig one day and I looked horrible. I mean, I truly looked, and I mean this not disparagingly, but I looked like someone who was trying to dress up like a man trying to dress as a woman. It was terrible. It did not look right for me at all. And so I immediately was like, why would I do this? I mean, I'm not covering anything up. It's not like it's a secret I'm going through chemo. I had no eyebrows, no eyelashes. I was also really public about going through chemo. I was working. So I ended up walking around bald. It was actually really, again, I don't want to demean anyone else's feelings of losing their hair because everyone feels differently, but it felt very clean. It felt really interesting. I actually was like such a conversation piece. And so when I was then done with chemo and I thought, oh, I'll grow my hair back like everyone else. Of course I will. And then every couple like weeks that it would get a little too long, I was like, I don't have the patience for this now. So I'd clip it. And I ended up just keeping it short. And so the fun part was it makes my life so much easier. I go to the hospital at 3 a.m. Like I don't have time to take off my jewelry and do my hair. So I leave on my jewelry. I don't do my hair. But it ended up being this hilarious, like if you've seen my social media, and I think I sent you guys my license picture, it ended up being kind of a hilarious.
Oh, you did.
I mean, that's
Talk about a flashback.
And I'm also fine looking back in a couple of years and being like, well, that was ridiculous. Why did I think that was a good look? I don't expect that I'm always going to look great and perfect. I expect that I'm going to do what makes sense at the time for me, and it's going to evolve and I'm going to grow and change. And so partially it's because it's easier. Partially it's because I like sticking out a little bit and being different. Partially, like you said, maybe it reminds me of this powerful time. I mean, listen, going through cancer sucked. I don't want to like sugarcoat it and be like, it was an amazing opportunity. It was shitty, horrible, exhausting, stressful, anxiety provoking, painful, all the things. I had a lot of complications. I went through chemo, all of it. But it also actually was a time where I actually worked less than usual, which was fascinating and amazing. I really got to meet and connect. I mean, it really helped change the trajectory of my career because not only was I an OB-GYN who helped take care of patients, but now I was the OB-GYN who had cancer where patients listened to me differently. I got to actually get into the media space in a different way because of my voice. So yeah, that might be part of it also. And literally, like I said, it's actually just easier. I mean, I can get dressed in 15 minutes flat. I just got to put on a lot of mascara and that's it. I don't have to do stuff. Yeah. And not just for an OB who still delivers babies. And then 10 minutes later is like on a telehealth call with someone in midlife. Like, I just don't have the time.
Yeah, you're a busy girl.
No doubt. And
you
Shieva,
girl.
I can say firsthand that you have helped so many people. I know.
Thank you.
Several people that you've helped very personally. And I know there are gobs more.
Thank you.
At your events and so forth. And I think that your story or your
journey, maybe?
Pause. Yeah.
Oh, okay.
Yeah. Hold up. Let me say that again. Shieva, I know firsthand some of the people you've helped and also the outreach you've had. So just thank you from all of us. Thank you also for your story about your hair and the wigs. I think that could help a lot of people.
Yeah.
So,
yeah.
And you're very inspiring in the sense that you're upbeat, you're honest, you're open, you kind of beat to your own drum. And I really do think that for older women and younger women, it's important to, like we said, have these conversations. So we are very grateful that you chose to join us. We just have a few little fun questions to end our session. So my question is, if you had one piece of advice to give to the world after all your experiences in life, what would it be?
Okay, can it be a couple things woven into one?
100%. You go, girl.
It can be anything you want.
I'm going to weave in the mindset and the medical. One thing someone said to me actually recently was, oh my God, you're so confident that you can be so open. And actually, I think it's the opposite. So I try to implore, especially younger people, to learn early on. I don't think I am confident and therefore I'm open. I think I am confident because I'm open. I think the openness came first. I think I decided that I was just going to let it out and be open. And that helped me be confident because, like I always joke, if I say I've got a big butt, then you guys aren't like, oh my God, did you see her big butt? Right? Like there's nothing to talk about. If I say like I was bald or whatever it is, I talk about my weight. I can't talk about all these things. I talk about like my trials with my marriage, all that. Then there's really nothing to talk about. And then I don't have to be embarrassed, right? And then with that confidence, I think from a health perspective, you can release your fear and you can actually acknowledge what are the tools that you need to be able to be proactive without being paranoid about your health, in particular about things like cancer risk. Like I've talked frequently, people are so scared of abnormal pap smears, abnormal mammograms. They're so scared of things that are actually quite common that are rarely going to kill them if they know the data, they know their body, they know what they're screened for, they know their symptoms, they know how to get help, and they maturely recognize that, yes, I might end up getting HPV or herpes or cancer or a miscarriage or any of these things, but I'll likely get through it and survive it if I'm confident enough to have learned how to traverse it. But we all walk around kind of saying the same things to ourselves. Like, I'm just so scared. It's like a soundbite we say to ourselves over and over. And then it really leads to avoidance and it leads to an inability to actually traverse these things when in fact we all end up traversing them, right? Like think about, you do not know a woman who didn't have one of those things I just mentioned, right? I bet you don't know anyone who hasn't had at least something or a close relative with one of those things. And we've gotten through it, but we could get through it better. And we could actually find all those things earlier and with less fear if we learned and weren't like constantly telling ourselves this narrative of like, I'm so embarrassed, I'm so scared, I'm so alone, I'm so different, right? You're not alone. You shouldn't be scared. You're going to get it probably, and you're not so different. You can get through it better, right?
Yes. Oh my gosh. I absolutely love that answer. And to your point, I mean, I've had a couple biopsies that ended up being nothing. But I was sort of terrified during that 24, 48-hour period. And I've had it twice. So I would hope that if I have it a third time, after listening to you, I'll be a little calm.
Well, let's be really concrete. I love this because I hope that you don't have to go through it because let's face it, no one wants breast cancer, right? But let's be really concrete. If you go through your screening mammogram, which means you didn't have any symptoms, you went in for your screening mammogram and it leads to a biopsy, which is not so uncommon. And let's say that biopsy leads to cancer. The vast majority of time, it's going to mean early stage cancer, either DCIS or early stage 1. And guess what, ladies? Guess what the 5-year survival statistics are for early stage cancer?
Okay, now that you're making it sound like it's really high, I guess I would say 90%.
99%. Do you know what the 5-year survival for all breast cancer is? 91%. But for early stage breast cancer, it's 99%. And those are the ones that are often found from the screening mammogram, meaning not because you felt a lump, which might be more advanced. So I'm not suggesting like, don't be nervous and anxious, because I say to patients all the time, I'll never tell you not to be nervous and anxious, because that is a normal thing to feel. And I will lose my audience if I ever say that, because I'm nervous and anxious all day, every day. But I don't want you to be scared, because it's common and it's totally survivable if you find it early. And if you continue to be scared, for some people, they avoid things because they're scared. And for others, they'll still do it, but they'll increase their cortisol levels so much that what does that do to us, right? And it's an unnecessary feeling, right? There's like enough going on in our world to make us truly scared. Why would we invoke fear when we don't need to? And again, I'm not suggesting it's a walk in the park. It's easy. I've been through it. Cancer sucks, hands down. But we should try to prevent it when we can. We should try to then find it early, because then we can fix it. And then we don't need to be scared. There's like so much unnecessary fear. Yeah.
So that leads me to just ask, in terms of, they have amazing mammograms, sonograms, but they don't really have anything to scan for ovarian cancer, which, do you think that's coming down the pipeline? Because I don't know too much, but I do know that I feel like that's one that can be sort of silent and deadly. And if they had a screening for that, it would just be amazing.
Yes. So, I mean, we could do an entire episode on that, which I've done episodes on that. So it is unfortunately called the silent killer, which is really bad because that disables people from having any agency in being able to find it. So I always say it's not silent, it's subtle. Most people with ovarian cancer present at stage 3 or 4. 2/3 of women present at stage 3 or 4 because the symptoms are subtle. And as women, once again, what are we taught? Suffer before you present. And so most women, all the data shows, will have had 6 or more months of the subtle symptoms, which are bloating or pain or pressure in your pelvis or your abdomen, feeling full early. And these subtle symptoms, think about it. We feel them all the time. We're taught that like, oh, it's because you drank too much wine or you ate too much pasta or something you did. So we're taught to just like, leave it alone. It's likely nothing. It's likely nothing. When instead, what I tell my patients is if you have bloating or pain or pressure for more than 2 weeks, don't freak out. It is likely nothing, but don't blow it off. The only way I will ever agree with it's likely nothing is if I've done a test to prove it. And that test is typically a pelvic ultrasound. But to your point, that is not a screening test. A screening test by definition means I've had no symptoms. Once I have symptoms, it's a diagnostic test. And so do I think they're going to come out with a screening test anytime soon? Unfortunately, no, because ovaries are deep inside. They're small and they're sneaky. So it's not like we can readily squeeze them like a mammogram or sample them like a cervix or sample them like even a colonoscopy. So we need to try to find less than probably a radiology test, some kind of blood test marker. And they've been working on it, but they just haven't found it yet. So until then, women need to not be fearful, but they need to be proactive. They need to know the symptoms and they need to assert themselves with their clinicians, which is a hard thing to do because there's so many layers of this. There's like insurance coverage, there's knowledge, there's all of it.
Right. And I would love if you were willing at some point to sort of dive into that, because I think that could be a super interesting and very helpful conversation.
So we're about to wrap up here, but I do have one quick question myself before we do. Outside of this medical fear and those moments, when, Shieva, did you find yourself facing like an actual what the F moment?
Oh, I mean, God, there's so many. I will tell you, a couple days ago, I found myself really feeling like, because I really, I mean, I say it so frequently that I almost like have detached myself from all the information, but I really reflected and thought, God, I'm 55 and I've had 6 miscarriages. I've had endometriosis. I remember being told I had HPV at 22.
6 miscarriages? Wow.
But I have 3 babies, thank God. But I remember at 22 being told I had HPV by a really terrible clinician who made me think I was dying of cervical cancer, who was completely wrong, obviously. But, you know, I had weight loss surgery. I mean, all the things I've gone through. And again, I'm sure you two could be like, look at what you've each gone through so many things too. Maybe different, maybe not medical, maybe emotional. Obviously, Kristin, you've gone through what you've been through, which you must be like, I'm sure for Kristin, with just what I know of your experience, you're kind of like, oh yeah, this is what happened. It was, blah, blah, blah years ago. And I lost my leg. But there's like, it's so woven into your story, right? But aren't there times that you stop and you're like, wait, what the fuck? And I think every woman has that. We have so many more organs than men do. We have so many more physiologic processes between periods, pregnancy, menopause alone that we have to get through. Like every day I'm like, oh my God, what the fuck? But the other day it really, really hit me because of another situation that I don't have the latitude to disclose because it was a private circumstance that I would talk about, but the person I was with probably wouldn't want me to talk about it. But it really made me reflect and think, what is going on for us as women? We are just expected to withstand and suffer through so much and do it like with fucking mascara and serum on our face and look good and like pretend like it's all okay, right? It's crazy what we go through, right?
Nuts.
So that was it. Yeah.
Oh my gosh. Could stop. We could talk for hours, Shieva, but we won't keep you because you're so busy.
Thank you.
But tell the listeners, please, where can we find you? Any upcoming exciting events? You do such fabulous things in the community and globally. Is there anything we need to know?
Well, you can find me. I'm mostly on social media on Instagram, Dr. Shieva G, which by the way, for fun, it's DrShievag. So, because my last name is Ghofrany. So VAG, Vag is in my name. So I'm on Instagram, Dr. Shieva G. Yeah. Or my website, Dr. Shieva G. And I still deliver babies.
Say Vagina Month.
Say Vagina Month. Say Dr. Shieva Vagina Month. I'm still delivering babies with my partners in Connecticut. And then I have a separate telehealth practice for Connecticut and Florida. And it's all on my website, Dr. Shieva G.
Do you still perform regular GYN services?
I don't perform in-person GYN in my office as of 3 years ago, not because I don't love gynecology. I don't even want to say I love it more, but I love it more, if not same or more than OB. But just because of some changes I wanted to make in my life, I wanted to be able to do more education. I actually wanted to be able to like go to the gym and exercise for the first time in decades. So as of 3 years ago, I'm full-time obstetrics for our practice, which technically ends up being a part-time job for me because I'm used to working like OB-GYNs really work like double time. And then I have my separate telehealth practice for anyone who needs help during this midlife, like not just perimenopause and menopause, but all the things we talked about, like strategizing cancer risk, understanding the risk, understanding what they need to go through. I really want to help them. And the sad part is I have to do it outside of insurance because it takes time. I spend hours with each patient through telehealth calls and messaging. But so I'm sad that I can only kind of help a resource group of patients on this side. And then in my obstetric practice, we take all of the insurances, including Medicaid. And then I'm happy to be able to like educate for free. So that's where they can find me.
That's wonderful. Shieva, can they connect with your telehealth practice through your Instagram or?
Yeah, there's a link to my website on Instagram.
Okay.
Yep.
Okay.
Yeah.
Fantastic. Oh my gosh.
Fantastic. Well, this has been such a treat.
Thanks,
Thank you
ladies.
so much
Thank
for
you,
joining
guys.
us.
Thank you. I really
We are so
appreciate you
appreciative.
guys. Thank
we
you.
are so appreciative. What good. This information has been incredible.
Incredible.
I mean,
Eye-opening.
each topic we could dive into in a separate episode.
We know that there are literally a million podcasts out there, and so many of them are so, so good. We'd love for you to tell your friends, daughters, and all the women in your life to tune in, get real, and share all the things.
Yes, share your stories with us by DMing and following us on Instagram at Gals Get Real Pod. And please subscribe, like, and share wherever you get your podcasts.
Until next time, lots of love.
This podcast is part of the Sound Advice FM network. Sound Advice FM, women's voices amplified.